Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by Ileana Acosta, who is the Program Manager of the Adult and Adolescent Substance Abuse Programs at RUMC, along with Anthony Arpaia, a nurse who is an active Deputy Chief with the FDNY and the Healthcare Coordinator for RUMC's Silberstein Center. Welcome. Thank you for joining me today.
Happy to be here. Thank you.
So through RUMC Connections, you will meet the fantastic doctors, nurses, and medical professionals that make our hospital thrive. We'll also provide useful information about your own health, explore the latest medical news, and hopefully get you answers to some of your own health-related questions. Now, today is Season 2, Episode 1. We are going to kick things off with our addiction services. Now, drug addiction is a complex disease. It takes more than willpower to overcome the problem. However, with the right treatment and support, positive change is always possible, regardless of the circumstance. Addiction affects not just the addict, but the family as well. Richmond University Medical Center provides a variety of comprehensive addiction treatment programs and services at the Center for Integrative Behavioral Medicine, located at 1130 South Avenue in Staten Island, New York, which we will be learning about more today. As I mentioned previously, we are joined by Ileana Acosta and Anthony Arpaia. Ileana received her bachelor's degree from John Jay College of Criminal Justice, where she graduated magna cum laude in forensic psychology. Ileana received her master's degree from NYU School of Culture, Education, and Human Development, Master of Arts in Counseling for Mental Health and Wellness. Anthony is a registered nurse and active New York City firefighter. Anthony graduated the College of Staten Island with an associate's degree in nursing in 1995 and joined the FDNY as a firefighter in 1997. After 2 years with the FDNY, Anthony returned to nursing and has been in behavioral health sciences with RUMC since 2000. In 2001, Anthony returned to CSI and completed his BSN while studying for promotion within the FDNY. He worked per diem for 15 years with RUMC's psychiatric inpatient unit and has worked at the Silberstein Center since 2015. Anthony is currently an active Deputy Chief with the FDNY and the Healthcare Coordinator for RUMC's Silberstein Center. So welcome once again. So maybe you could tell us a bit about the programs that you oversee and describe the services that are offered in each program.
Sure. So first I want to start by talking about the South Shore Safety Net and the Youth Achieving Independence Program.
Sure.
The South Shore Safety Net program serves youth ages 16 to 24 who are at risk of using substances or are currently using drugs.
Okay.
And so when I say at risk, I just want to pause for a second and explain what that could mean. At risk could mean, for example, being homeless. It could mean if the child is living in the home, perhaps a parent is using drugs. It could mean that they're having academical difficulties. So anything, environmental situation, living situation, that could potentially place a kid at risk of using drugs. That's who qualifies for the South Shore Safety Net program, 16 to 24 at risk of using drugs. The Youth Achieving Independence program is for youth also 16 to 24 who are diagnosed with a mental health condition. So it's the sister program. The only difference is that one treats substance use, one mental health disorders.
Okay.
And the programs are both certified by the New York City Department of Health and Mental Hygiene. And the program is an evidence-supported, community-based early intervention model called Transition to Independence Process, so the TIP model.
Okay.
And the TIP model focuses on 5 things. It focuses on educational opportunities, living situation, community life functioning, personal effectiveness and well-being, and employment and career. Services are designed to strengthen families and help youth to develop competencies and skills that promote economic self-sufficiency, self-reliance, and personal growth. So one thing that I wanted to speak a little bit more on is that age, the 16 to 24, it's such a vulnerable time
Absolutely.
in someone's life. at that age, you're, dealing with a lot of insecurities. What am I going to do when I get older? Am I going to amount to anything? You have a lot of thoughts of just generally like feeling insecure about what's the next phase. And that's why I think that transition to independence and that the goal of the program really shines in just helping kids through that transition. And you have these insecurities at that age when you come from a place where you actually have resources and a loving family that can help guide you. Imagine for kids who are homeless and don't have that support, how much more difficult it is for them to deal with those insecurities and have those challenges. And that's one of the reasons why this program, I think, is just such a blessing to the youth that enter it. So the program provides case management, referrals and linkages, opportunities for community engagement, computer training, GED, and college readiness training. Another really great aspect of the program is that it does Career Club, which is a curriculum that is prepared by Columbia University. And the curriculum is taught by life coaches who work in the program, and it's personalized to meet individual needs of students. The life coaches actually go into different schools and work sites throughout Staten Island to teach the students in 11th and 12th grade. And they, during one class period throughout the entire school year, the life coaches go into the schools and they teach the curriculum. We're in Port Richmond High School, South Richmond High School, New Dorp High School. And it's also incorporated in our group therapy program. We have a clinical program, which I'll speak more about later, at South Avenue. So they actually go into the group therapy to teach the kids, to share the curriculum with the kids. And it's tailored to help youth navigate things like finances, how to find a job, how to write a check, what to wear on an interview, how to write a resume, and everything that encompasses them to be self-sufficient. Some students after high school, their goal is to enter the workforce, after school, whereas others may want to go into higher education opportunities like college. So it's individualized based on what their goals are after high school, right? So if their goal is to further their education, then the life coach would help them identify what steps they need to take in order to do that. So like, these are my strengths. These are the majors that align with my strengths. These are the colleges available that offer that major. And so, like I said, the Career Club, even though it's called Career Club, it's really individualized because not everyone may want to immediately enter the workforce, but other students want to, further their education.
Of course.
Another great aspect of the program is that they have social events for the youth. So obviously, this is an opportunity for them to maximize their social skills in other ways other than using drugs. And it also helps them mitigate the negative impact of their mental health challenges and work through those difficulties in a safe place, in a safe environment that the program provides. So social events run on a large scale in that they have up to 25 kids attending these social events where the youth can socialize with everyone, or they may choose to just connect with one or two people that they share similar struggles with. So it's a really great, I know that they've done different events like at Dave & Buster's, Applebee's, the bowling alley, pottery making places, game day. They do in-house events too at 1130 South Avenue.
Oh, that's great.
I know that they've even done, for one of the youth that was expecting, they held a baby shower for her. So it's just like
Nice
awesome.
sense of community.
Nice sense of community
Absolutely.
support. So although their goal is to center their services around employment, education, and vocational services, Safety Net has the ability to break through in the interim any challenges that a youth may be facing. Safety Net really supports a youth in their challenges by assisting them with things that may stop them from moving forward. Personally, I know Safety Net to take a youth food shopping, for example, because there were struggles in the home with finances. Take a youth clothes shopping, to help them feel a part of society, help them feel confident, take youth grooming, such as for hair and nails, provide personal hygiene products, and pay for school applications. For, college school applications, there always tends to be a fee for those.
Yes.
And largely the program does work with homeless youth. I think I might have mentioned that earlier. I think that kind of gives like a good overview of the different things that the program
Absolutely.
offers.
No, it does, for sure. And maybe you could share some of the success stories that the program's had?
One of the greatest success stories, and I will say this. So Basilio Allen, he's the direct manager of the program. Yes. And when I was talking to him about this podcast, and we were sort of like planning out, what to talk about, and it came up, well, we should talk about some of the success stories. And I turned to him, and he paused. He was thinking of, which of the many that he could share. But I said to him, you are probably the greatest success story. And he gave me permission to share this on the podcast, so I'm not like breaching confidentiality right now. But I said to him, you are probably the greatest success story, because he was actually the first client of the program when they opened their doors in 2008. And he worked diligently with his life coach to achieve his goals. He personally shared with me that he's had challenges of homelessness himself and being in the foster care system. But because of the safety net program, he received help, and now he runs the program.
That's amazing.
Today.
So admirable.
Yeah. So I think that, I just really wanted to share that. Just kudos and shout out to Basilio. He does a great job with the program, too.
He does.
Another success story, there was a youth residing in the TIL program, Transition Independent Living, which is a homeless program through Project Hospitality. He was homeless, worked alongside her life coach to get into school, obtain a full-time job, and live independently after 2 years of being in the program. The youth currently holds a 3.8 GPA and is going into her 4th semester of college. Okay. Lives on her own independently, where Safety Net has helped her get some domestic items for her home, and is working full-time as a teacher's assistant.
That's fantastic.
And then just the third one that I'll share is another youth who has had his parents involved in his care. He came to the program with no direction of what he wanted to do, and after establishing his goals with his life coach, he identified what his future plans. He has graduated a trade school, graduated high school, now working in a union position where he receives benefits and is able to financially support himself. And he now lives on his own. So when you're that age too, like you're one of the goals that you have is like, I want to eventually like be financially independent and move out of my parents' house. Those are just some of the few success stories.
It's hard enough to accomplish those things in a fully functioning home. Yes. So let alone, kudos to these kids. That's wonderful. Yes. And what a fantastic.
I think that's a testament to the workers that are at Safety Net to like be able to take people in, make them feel comfortable
and
enough
guide
to
them.
Share and give the experience together.
Exactly.
That's a vulnerable
cool.
space to put somebody in, of course, and to have that support and guidance. You couldn't ask for more.
Yeah.
That's
Agreed.
wonderful. Wow. So now if somebody is listening and they were interested in becoming a client, how do they go about doing so?
So you would simply call the number, but you have to so you have to be between the ages of 16 and 24, as I mentioned, and either at risk of using, and this is very broad, right? Yeah. Like I explained, like there's many different reasons someone could be considered at risk. So, we're not too nitpicky about that.
Yes.
So 16 to 24 at risk of using substances or currently using, or you are diagnosed with a mental health condition, 16 to 24, and you would simply call 718-818-5057, and that's the number. And you would, just explain. You don't have to be referred by anyone. You could independently call. A parent could call. The client themselves can call. Let the person know that, you're interested in becoming a client of the program. And we're located at 1130 South Avenue.
And how frequently would somebody come for...
Yeah, so it depends. It's individualized, but typically the students are coming once, twice a week.
Once or twice a week.
Yeah,
okay.
and then like the frequency lessens as they, achieve their
More
goals and
independence.
become
Got it.
more stable.
Okay. So that was Safety Net and the Youth Achieving Independence Program. Can you tell us now about the Adolescent and Adult Substance Abuse Program?
Yes. So the adult program, the Adult Substance Abuse Clinic, is called Silberstein, and we serve individuals 18 and older who are seeking treatment for substance use and co-occurring mental health disorders. We are licensed by the New York State Office of Addiction Services and Supports, OASIS, and work to support the goals of that office, providing accessible resources to the community, all in an effort to reduce the negative impact of drug addiction in our community. Our clinic is staffed with licensed clinicians, credentialed alcohol and substance abuse counselors, medical and psychiatric personnel, and peer advocates. And we have Anthony here who will talk about more about his role in the medical realm. And then the adolescent, so that's the adult program. The adolescent program is also an OASIS licensed addiction program, which focuses exclusively on the treatment of adolescents and young adults ages 11 to 24. So both of the programs do essentially the same thing, except for one treats 11 to 24, and the adult program 18 and older. So we tend to refer, if we get a call, we tend to refer the clients that up to 24 to the adolescent and 24 and older into the Silberstein program, just to simplify. The path to recovery is different for everyone, right? So someone's goal may be to be abstinent and to stop using drugs altogether, whereas other people are interested in more of a harm reduction approach, and they want to decrease the risks associated of their use. The harm reduction is sometimes like a hard concept for people to understand or accept. If you shut people out that are interested in that approach, then you're missing such a large group of people. Not everyone. That's just realistic. It's not realistic to think that everyone's ultimate goal is going to be to stop using drugs altogether. So we take on a person-centered approach where we meet the clients where they're at, and we want to keep the lines of communication open, and there's no stigma or judgment. We really look at what the client's goals are, right? Our assessment process, so when someone enters treatment, our assessment process has 3 components. We complete a psychosocial evaluation, a psychiatric evaluation, and a physical evaluation, because understanding a client's history of substance use, family history, physical, mental health helps us design a person-centered treatment plan that accounts for all aspects of a client's health and well-being. So we offer a variety of in-person and telehealth program options. So the therapeutic services include drug, alcohol, and mental health assessment, individual and group psychotherapy. We have 9 groups that run throughout the week, in the daytime, in the evening. If people can't attend the program during the day because they work or they go to school, we have program at night. We stay open till 8:30 on Tuesdays and Thursdays. We have family therapy, so family members are able to be involved in helping plan their loved ones' treatment goals if they choose, if the client chooses. We do toxicology testing and case management services. And in addition, we also provide specialized services to mandated populations, so people who are on parole, probation, treatment court, ACS, or people needing to complete a court-mandated DUI assessment. We provide that as well. The psychiatric and medical services include comprehensive psychiatric evaluation, prescription of psychiatric medication when indicated. Sometimes we have clients who are referred to us by a psychiatric inpatient. They've just spent 30 days or whatever it is in a psychiatric hospital, and they're discharged on medication, on psychiatric medication. And so when they enter our program, which is outpatient, so the difference between inpatient and outpatient, inpatient, you're actually there staying for a period of time, whereas outpatient, you're coming and going for your appointment. So we're an outpatient clinic. So obviously when they get discharged and for there not to be a lapse in their treatment, we get them in, right after they're discharged, and continue their treatment. So continue their therapy, continue their medication. Just one thing that's important to note is that we're integrated. That's why the building is called the Center for Integrative Medicine. So we integrate behavioral health with medical services, right? So we're not just providing psychiatric services, we also have a nurse and a family nurse practitioner that can really serve as a primary care doctor for our clients. So it's kind of like a one-stop shop where they can, receive comprehensive, integrated services. And it's important too for that population. When you're using drugs, at times you tend to neglect your medical health. So to have that conveniently located where you're already, it's a huge asset. We provide also medication assisted treatment for, and this is where Anthony, if you can kind of speak more about that, including Suboxone, Sublocade, oral naltrexone, and Vivitrol. So, Anthony, at this point, if you wanted to kind of go into detail about different kinds of medication-assisted treatment.
Yeah, these medicines have been in use for a long time.
Okay.
A couple of them are new to our clinic. So Vivitrol we've been doing for about 5 years now. Sublocade only about a year and a half. So the medication-assisted treatment includes medicines like methadone, which we do not do. You have to go to an outside clinic.
Okay.
So it's a daily travel, get your dose, go about your day. So sometimes people are hitting up a methadone clinic at 4 or 5 so they can get to work by 6.
Okay.
So, there's a lot of constraints with that. So at our clinic, we have the substitute, which is Suboxone. Suboxone is kind of similar to methadone with the idea that it's going to elicit some opiate response. Not as aggressively as methadone.
Okay.
So they call it a partial agonist. So partially, it gives some relief.
Gotcha. So
Right.
these are medications that are for people who are on opioid
Opiates.
drugs. Okay.
Yeah. So I have worked at the methadone clinic
Yes.
on Staten Island. So
Okay.
I've done that. I've seen all different aspects. And,
We have clients on methadone, but we don't dispense it at the clinic, like Anthony said.
Yeah.
Yeah.
you have to go to a separate clinic. And listen, this is words out of the client's mouth at methadone. Sometimes they call it liquid gel.
Okay.
Right, that's been said. I've heard that because you have to go constantly. And sometimes being on Suboxone, you can get the prescription.
Right.
You could be in control, take it, and go at your leisure.
Yeah, methadone is a daily thing, whereas Suboxone is a prescription that you can take at the in the convenience of your home,
And you take it daily.
and you take it daily as well. Suboxone.
Okay.
So
The idea with Suboxone is that it's potential for less abuse.
Gotcha.
Right, because it's a partial, you can't, it's like having a Ferrari and not being able to go 200 miles an hour. The Suboxone will only let you go 50 in that.
And so to
Okay.
talk about how it sits on the receptors too. I
Yeah.
think that's a good way of explaining it.
Right. So, when somebody is using opiates, right, the response that the body and mind has, right, because everybody tends to think that addiction is willpower.
Yeah.
Right? Maybe the first couple times you use it, you make a decision, but very quickly, even in my role in the fire department, when guys get hurt, the frequency of getting the pain meds, it's instead of getting, a month's worth, now it's like 5 days and let's reevaluate because after that short time, your body can be dependent on it. Right? So the opiates, what they do is they kind of sit on the opiate receptors, which sort of takes the brake off the dopamine response, right? There's neurons that control the dopamine release. You take an opiate, that brake is off the pedal, and now you can get a flux of dopamine throughout your body, and it is pain relief, euphoria, and continued use, you can get tolerance, right? So instead of one pill allowing you to get pain relief, you need maybe 2 pills or more frequently, and that's how addiction happens. So methadone sits on the receptors just like Suboxone, the active medicine is buprenorphine. But what it does is it sits on it and sort of lets things release calmly. So you don't have an overload of dopamine, but just enough to get through your day. What we're finding is, though, Suboxone could be prescribed daily, once a day, twice a day, 3 times a day. And sometimes I'm starting to see now, like, not everybody's on a schedule to go to sleep at 10 o'clock at night or 9 o'clock. They stay up late. The Suboxone will go up and down, fluctuate. They may feel lousy by the end of the day and need to take another one. So it's not an exact science, but abuse does come in with the Suboxone, the oral films.
So what would you say are some of the most commonly abused drug trends that you're seeing at the clinic?
We see a wide range of people presenting with different drugs. a lot of times we see people that did get a prescription of opiate painkillers and then their use escalated to heroin use. We see people coming in with alcohol, cocaine, marijuana, any drug, you name it. We've seen it. But I think a very common is what we're seeing is opiates. Opiates, people starting with the prescription, escalating to heroin IV use.
And we have also, besides the Suboxone, which is an oral, make you fluctuate, the Sublocade is injectable, brand new to us, tons of success. People that maybe have been on Suboxone for 7 years, struggling to get off. The injectable form is once every 28 days, no fluctuation through the day. You're sort of steady state, and you can stay up late, go to bed early, and you do well. You do very well.
And are you seeing a prevalence of fentanyl on Staten Island?
Yes. So a lot of times what we see too, because I mentioned earlier we do toxicology testing, is that when people see the results, they know that are using heroin, but they're seeing fentanyl also come up and unbeknown to them, right? So a lot of times, fentanyl is being found in products, heroin, cocaine, methamphetamine, and I can't tell you how often that happens where the client is completely unaware that they took fentanyl.
And it's very lethal in such a micro amount, right?
And Meredith, that's why, but the Narcan kits, Narcan, which the active medicine is naloxone. Narcan is brand name Narcan, just like Tylenol would be for acetaminophen.
Yeah.
But the Narcan is used for opiate overdose.
Okay.
Right, all the medicines we talked about. But fentanyl found in everything. I've had friends that, maybe overdosed because they went out to a bar, decided to do a little bit of cocaine, and no cocaine in their toxicology when they were in overdose. All fentanyl.
And fentanyl is a synthetic opiate that is 30 to 50 times stronger than heroin.
Yeah.
So where you look at a little pile of powder for heroin to overdose, with fentanyl, you're talking about a grain or two of salt.
Yeah, they said it's like the amount that fits on the tip of a pencil that it could be lethal, right?
It's found in 80% of overdose deaths in New York.
Scary.
New York State.
So at least with the Narcan,
Yeah.
the most important thing is it only is for opiate overdose.
Yeah.
The problem is fentanyl's being found in everything that's illegal, right?
Yeah.
So if somebody's on pills, like for a stimulant, a kid's on Adderall, but there's a chance that they use their medicines early. Maybe they're getting the rest of their month from illegal sources. There's potential that there's fentanyl in it. So when you don't know, I recommend spraying the Narcan and potentially seeing if it works.
So
It won't
Narcan-
cause any harm if
Yeah.
if you're using Narcan and someone who isn't overdosing, for example, it's not going to cause any harm to that person.
Yeah.
So it can't hurt.
So it's better
Can't
safe
hurt.
to, if you suspect someone's overdosing. But what I was going to say too is that heroin, I mentioned it's present in approximately 80% of overdose deaths in New York. Over 100,000 people are dying each year of overdose in New York State.
Wow.
So pharmaceutical fentanyl, right? It's prescribed for severe pain and end-of-life care, whereas non-pharmaceutical fentanyl is produced illegally and has been found in cocaine, heroin, ketamine, methamphetamine supplies in New York City, and even counterfeit benzos such as Xanax or Klonopin. And it can't be identified by sight, taste, or smell. And this is important too, is that obviously if your drug contains fentanyl, you're at higher risk of overdose. And the risk of overdose is even higher if fentanyl is present in opioid drug such as cocaine, and the person taking it does not usually use opiates, right? So if you're using cocaine and you don't have the tolerance for heroin, obviously you're at greater risk. So that's important. And since it's not detectable, one thing that I was going to also mention is that we provide. Oh, another thing that it's found in this new drug, xylazine. I don't know if you've heard of it, but xylazine is a veterinarian tranquilizer that people are now
Kind of goes by
tranq that people are now using. And it's like a deadly combination, obviously. So it's being found in xylazine as well. So one of the things that we offer and we provide at the clinic are fentanyl test strips.
Okay.
And so what these are, you can actually test your drug to see if there's fentanyl in
Fentanyl
it.
presence.
Yeah.
So this sounds very aggressive, really even very controversial in the groups we have with people in recovery. The concern is meet them where they're at, be there, support, show them no judgment, allow the conversation, and then hopefully while they're there, at some point, they can make that transition to get clean
Yeah.
once and for all and maybe not have to use the test strips.
Absolutely. Now, what entails
Yeah.
Narcan training and how is it administered?
So, we were getting Narcan from the state, other people who had extra kits we would give out. So we applied for the license to be an opioid overdose prevention program.
Okay.
So our clinic is it. We supply Narcan to the ED, psych inpatient, CPEP, and all the other behavioral health outpatient areas. So basically, the Narcan will reverse an opioid overdose, right? Heroin, Percocet, hydrocodone, all these things. But like we were talking about, fentanyl can be found in anything illegal. You don't even know if your cocaine or Xanax or Adderall are the cause, if they're illegal drugs, if that's causing the opiate overdose. So basically, in the kit provided, you have a bunch of things. You have gloves you can use. You have a mouth barrier in case you do rescue breathing so
Okay.
you don't get contaminated.
Of course.
Problem with this is sometimes it's an aversion for people to do anything. You can do rescue breathing at some point, but what's in the kit that's going to save their lives is the brand name Narcan.
Yeah.
This is naloxone. Naloxone is very aggressive to the opiate receptors. The opiates sit on the receptors, calm, quiet everything. They quiet the breathing down to the point that they're not breathing,
Wow.
right? Blue lips, blue fingertips, snoring. So they are about to die. They are barely breathing. The Narcan kit,
Right. So if you see someone who used to, so the signs of an overdose, if you see someone who said, what does it look like? Anthony mentioned it, unresponsiveness or loss of consciousness, slow or stopped breathing, blue, gray, or white lips and fingernails, snoring. So sometimes you see people like hunched over, this is a potential sign that they're overdosing. And if that happens, you would respond in such a way where you would first call 911, right? Go ahead.
yeah, you would, obviously you're going to supply the Narcan to the client, patient, whether it's a family member or somebody you see on the outside, you call 911. You put this little atomizer in their nostril and you spray it.
Okay.
One dose done, you don't get another chance. You wait two or 3 minutes. At that point, you can do rescue breathing if you like, while you wait for EMS or 911 to come. After 2 minutes, if there's no response, if they didn't spontaneously start breathing and coming out of their lethargy, you would use the other one in the other nostril,
Okay.
right? The science is use the other nostril in case they have a deviated septum to make sure the medicine gets to the sinus and absorbed.
Okay.
Right. The reason why you call 911 because there's a chance that people may use together. Maybe they have the idea like, oh, we got out of that. That was a close call. Let's go back to doing what we were doing. Let's, put Netflix back on. The Narcan only lasts 30 to 90 minutes. So there's a chance when this wears off, the opiates sit back on the receptors and then back in overdose.
Wow. So
911 has to be called.
And then
Right.
what would happen if, occur again? Could they get another
They could.
Narcan?
It would work
Okay.
again.
Okay.
So having more kits is a possibility. There are times where somebody uses enough opiates that sometimes 2 sprays doesn't work.
Wow.
EMS has intravenous Narcan. It gets there quicker.
Yeah.
Bolus dose.
That sometimes needs to happen.
Needs
and
to
this isn't
happen.
enough. They have to
Yeah.
use the IV.
Or you can use
Narcan.
multiple doses. If I have 8 at my house and something happens to one of my family members, I'm going to use what I can to make sure they
So-
start to come around.
When the Narcan is effective, how does somebody
They will
react?
come out of it and be
Yeah.
pretty uncomfortable and pretty upset.
Yeah.
I've heard they could be
Yeah.
very angry.
Yes.
Yeah.
Because they're now in withdrawal.
So the
Right.
problem is, like people will come out angry. You got to be careful. You may get beat up. So like there's an aversion there, right? But what's happening is lots of times these people don't even know they overdosed, right?
Yeah.
Yeah.
And they come out, they're confused. They kind of snap out of it, but it's not like right to their feet,
Yeah.
hitting you. But they're uncomfortable. They're in a complete withdrawal, which is maybe the worst flu-like symptoms, anxiety, depression. Just your body is quivering and aching because This sits on the receptors so aggressively, like they have nothing in them.
They're
and it
immediate
is
withdrawal.
Immediate withdrawal.
Okay.
And it's a terrible
Now,
feeling.
is this something that the fire department always has on hand now as well?
Oh, yeah. For years, they've,
Yeah.
first responders, the location of the firehouses affords them geographical coverage. They're on scene first, and many times firefighters will spray the Narcan.
Yeah.
And so at the clinic, we offer a Narcan kit so how do we distribute Narcan? We offer a kit to every single client who is admitted to the program. We distribute them at outreach events, community events, and we also, Anthony mentioned this, we supply the medical emergency room with kits, and the
Okay.
medical ED, RUMC's medical
Yes.
ED gives out about 200 to 400 kits a month.
Wow.
And Anthony's also involved in training the department, the behavioral health department, the staff in Narcan and overdose prevention. So we're trying to get it out in as many hands as possible. And another thing that I just wanted to quickly mention is we also talk about different overdose prevention tips. So if you use drugs, use them with other people.
Yeah.
Right? Don't use alone. Take turns. I mean, again, this may sound odd, but we have to talk about these things. People who are actively using, actively testing positive, we want to go over these different overdose prevention tips. Test your drugs, right? If you're
Yes.
going to use, we offer the fentanyl test strips. Avoid mixing drugs, using different drugs together, including benzos, right? And fentanyl increases your risk of overdose. And go slow, right?
Absolutely.
Take small amounts.
Of course.
We go over those tips as well.
No, I 100%. I want to thank you, Ileana and Anthony, for
Thank you very
joining
much.
today and for all that you do to help people in our community. This was extremely informative. And for anybody who would like more information about the addiction services, they can call 718-818-6970 or
Yes.
visit rumcsi.org. Thank you once again.
Meredith,
I'm
thank you so
Meredith.
much.
Thank you so much. Thank you.